start the session.
Thank you, Dr. Satish. Welcoming you all to a different sort of session from PharmaState Academy. This time it's called StressBuster. I'm Swati Sinha, host for you today, and navigating the topic along with Dr. Sumit Mehta on this. And let us, talk about stress in this topic, talk about the ways how we are going to deal with it. Since the topic is quite important, we will try to break the session into two sessions. Today will be the first session where we talk about stress and all, and there will also be another session. And then there will be a series which is actually focused on, creating good lives for you. So yoga and all those things will also be in kitty. But today we are talking about stress and the ways to release it. So just a few thoughts which came to me this morning, I'll share with you. And then we will hear from the expert, Dr. Sumit, on the topic. Together with a skilled psychiatrist, we will try to dive into the topic that will supercharge your mental well-being in the pharmaceutical world. In this fast-paced world, stress is there, whether we recognize it or not recognize it. You all are underweight of deadlines. We are in underweight of deadlines, high expectations, restless nights sometimes, and sleep patterns are affected. And stress takes its toll, whether we realize it or not. It is affecting you. Your decision making gets hindered. Your productivity, decreases, and it also affects creative thinking, which we want to do always. As a professional, we want creative things to happen. Your physical health may suffer. Stress can strain relationships. You do not know when the stress from your professional life has seeped into your relationships, your professional lives, and you are yourself isolating from your support networks. So recognizing the impact of stress is crucial, and we need to develop effective coping mechanisms, reclaim balance in our life. We try to bring to you these sessions on creating good life, and this one is called StressBuster. In the workplace also, sometimes people say stress can be a motivator. Yes, it can be a motivator, but what is that optimum amount of motivation or stress we need to get going? It actually helps us sometimes in getting meeting the deadlines or doing our tasks, but we need to recognize what is that break point where you should not be taking more stress and relieving yourself of unwanted stress. So yes, but amidst all this chaos, ways, what all, there is a hope. And hope is talking about it and recognizing that you are stressed or I'm stressed, and taking charge of our well-being. In today's life, we need to take charge of our health first. Health is the wealth. There are no two ways about it. So in this shared journey, we learn that stress is a part of life, but it need not define us. No one shall, talk in office that the person looks stressed or he's always in stress. This should not be your definition in office or even at home. And recognizing this all, we wanted to bring to you, and hence succeeded in bringing the session with the Dr. Sumit Mehta. Let me just introduce him. He's a friend, and also qualifications MBBS and MD Psychiatry, working as Associate Professor in Department of Psychiatry in Sri Guru Ram Rai Institute of Medical and Health Sciences and Indresh Mahant Hospital since July 2013 in Dehradun. Consultant in Department of Psychiatry in Synergy Institute of Medical Sciences since July 2013 in Dehradun. He is also Joint Secretary of Indian Psychiatric Society, Uttarakhand State Branch, licensed with Norwegian Medical Council, and he is also a thesis guide and PhD thesis, and he has many publications to his credit. This is in short that I introduce Dr. Sumit Mehta to you, and over to you, Doctor, to take us through this journey, help us all understand, recognize, and then overcome these stress factors.
Thank you, Dr. Swati.
Good morning to you and good morning to everyone who has joined us from various parts of the country and from outside the country also. Well, at the outset, I would like to thank PharmaState for giving me a chance to speak on this excellent platform of theirs. I really want to congratulate them where they have been nurturing careers, nurturing professionals, nurturing students, and giving something which we used to think that is it possible in India or not, or training of this kind is possible in India or not. So at the outset, I would like to congratulate PharmaState and thanks a lot for giving me a chance to speak at this excellent platform of yours. So Dr. Swati has already briefed the topic. I like to share my screen. Yeah.
Yes, it's visible, Dr. Sumit.
Yeah, that's cool. Thank you, Dr. Satish. Okay, yeah. Yeah, Dr. Swati has briefed the topic excellently. We all do face stress. But why we have choose this topic, why they have asked me to speak on this topic has a pretty interesting fact about it. Finally, we as individuals, as students, as society, or as community at large, have started to consider mental health important, have started to give mental health as much significance as probably we used to give or we do give to our physical health. Well, as Dr. Swati has mentioned, who does not face stress? Does a rickshaw driver does not face stress? Does a student does not face stress? Does a housewife not face stress? Does a businessman not face stress? So absolutely, it is part and parcel of our life. We are very sure about it. But we must understand from where we need to take care, how we need to understand it, and how we need to do small things which will prevent this stress from developing into a mental health disorder like anxiety or like depression. So it is important to understand and recognize and to take care. So this session is all about primary prevention or even primordial prevention, which we used to study, which is the concept in primary healthcare centers, which all of us have studied at some part of our lives, maybe in schools also, and in later education also. So this session is about preventing or giving ourselves a chance to prevent a future mental health problem and also to manage day in day out stress. We have divided this session into two parts. Probably I will be discussing more about what is stress and what are the causes of stress and how we react to stress in this session. And the next session will be more about how to manage it and what are the tips we can have in our hand to manage any kind of stress, or where we need to manage it or where we don't need to manage it. So yeah, just a minute, I will hide this. Will take 1 more minute probably. Yeah, Dr. Swati has already briefed about my introduction. I'm currently working in Dehradun and I'm associate professor in a medical college. Also, I'm a consultant in a corporate hospital. I was in Norway for a very brief period where I got registered in Norway, but predominantly I've been working here in India itself. So probably this is just a routine slide. But usually I start this session with this particular question. This is associated with few polls. I hope you all will get involved and will participate in those polls. So this is the first poll for every one of you. What is the weight of this glass, which you have seen on your screens? This is a half empty glass or a half full glass with water. What do you think? What is the weight of this glass? So this is a poll for everyone. Come on, fast. Yes. First question, first poll. The weight of the glass.
question is, what is the weight of this glass? 10 to 20 grams, 20 to 50 grams, 50 to 100 grams, 100 to 500 grams. Okay, I'm confused basically.
So we can guess.
So please guess, looking at the picture, the size of the glass and weight of the glass. There's water in it. I don't know what's the cue here, but please participate. Okay. There are more than 220 participants. Please participate. 70 responses till now. What is the weight of this glass? So I think, Satish, we can end the poll and
Yeah.
have a look at the answer.
Yeah.
100 responses already achieved.
So we have the second question because it is in continuation.
Okay.
So, okay, yeah,
That is
we
the
can end
next
this poll,
question.
I guess. So there is a pretty varied response. A lot of people thinking 20 to 50, 50 to 100, but we'll move to next question and next poll. Yeah, we can end this poll and move to next poll, please. Dr.
Yeah,
Satish,
it's
you can help me.
it's in the continuation. So you can
So,
see, just
I
scroll
will
it
request
down, you
everyone
will
to
see.
end this first poll and answer this second poll. Okay, we have already been answering second poll also. Good, that's good.
Yes.
So,
So how many
second
of
poll
you will
is
have problem? Yeah.
okay. Yeah, I will take it, Dr. Satish, from now.
Yeah, please go ahead.
So second poll is okay. So most of us believe it will cause no pain. Most of us also believe it will cause no pain in 10 minutes. So let's see what is the fourth option. Okay, that is the most important thing. So can we end this poll and see the results from everyone? For everyone?
Yes.
People are still participating.
Okay,
They are
please, they can
wanting
carry
to
on.
answer.
Yeah, they can carry on. Pretty interesting
Yeah.
poll and pretty interesting answers also.
Please participate. Since there were 4 questions, I also missed it. So let us take some more time. We will close at 150. People answering it, please come on and just.
Yes, there are 4 questions. You can scroll it down and you will find. Okay, so the fourth question is having a reverse order. So no pain 22, and then it went to pain 78%. Yeah.
Yes, we are
So
coming
let me
close to
end the
150.
poll. Yeah, let me end the poll.
There are still people are part. Okay, anyway, poll is ended.
I'm sharing the results. So question number 1. Swati, you can explain.
Yes, we are getting
Dr.
answers.
Swati, I can explain that.
Please,
Yeah.
you are the best person.
Yeah. So the first question is the weight of this glass. So probably we have such a varied response. The weight of glass is different for everyone. So that is how a stress can be different. A similar issue, say in our office, say in our family, everyone will perceive it differently. Okay. Everyone will consider some stressors as very important and some of them not very important. So we see why there is a varied response in first question, because everyone of us perceives a suspected stressor differently. See how we have, all of us have evaluated this glass very differently, but the importance lies from how long we can keep it. So if we keep on holding this glass for, say, just we start holding, there's no problem for everyone. We can see most of us has no pain in holding the glass. Just 12% felt maybe holding the glass maybe of pain. I don't know why they choose it. Holding a half a glass of water should not cause any pain to anyone, unless they have a small kind of injury on a hand or something else, some other issue. And on the third question, when we are supposed to hold this glass for 10 minutes, then lot more, 33% may have pain while holding this for 10 minutes. But when we move to 2 hours, say if we hold this glass for 2 hours continuously in our hands, 78% of people will start feeling pain. So this was the exact purpose of this poll. You guys have done wonderfully. I also thank Dr. Satish and Dr. Swati for creating this poll in absolutely perfect manner. The purpose is clear. We all will perceive some stressors differently. Some of us will feel that particular stress as significant. Some of us will not perceive particular stress as significant. But if we keep on holding on that issue, If we keep on thinking over it, ruminating over it again and again, that issue which was insignificant earlier will probably become significant. So it is not the stressor. It is probably the time we keep it with ourselves. Sometimes we need to let it go away. Okay. So longer we hold the stressor, more problem it will cause to us. Thank you, Dr. Satish.
We can move to the next slide, Dr. Sumit. You can cross the
sure.
poll at your side. Yeah.
Yes, sure. Just a minute. Yeah, so this is what the whole point was. There's nothing either good or bad, but thinking, and the time we keep on thinking makes it good or bad. So what is stress? What stress actually is in terms of definition, in terms of English definition? It is a pressure people feel in their lives, as simple as that. It can be anything. It can be anything, for say a small issue, or lack of sleep, or thinking about a career, thinking about the education, thinking about the exams. So it's a pressure which people feel in their lives, and it is almost inevitable. Each and every one of us will feel stress at some point of time in their life, and we have wide range of differences in reaction to stress. As we saw in that poll, there is wide range of differences. We perceive the weight of the class very differently. Similarly, we will perceive a similar stress differently. One individual may not feel it significant and may not react to it at all. Other may use his or her coping skills to react to it, and other may react in a pretty bad manner about the stress and may affect him, which we will see in future slides, how it may affect that particular person. So why we are having this presentation here? Because we are seeing the effects, which is seen in the rising rates of suicide throughout the world, especially among 15 to 20 years old. But we must keep in mind, there's a basic belief that only women face stress. Only women are the one who suffer from the stress. But various studies throughout the world have shown that men commit more suicide. I'm talking about completed suicide, that is, which leads to the end of the life. Although women may attempt more suicide than men throughout the world, but completed suicide is more common in men as compared to women. And under high stress, we can react very badly, as we have lost our thinking, as we have lost our memory. So our biological age may be 30 times higher when we are in a very stressful situation. And also, we have been seeing that depression among youth have been increasing in the last 5 years. This is from a pretty recent data from North India. And lot of the visits to the hospitals are because of stress-related problems. It is not that if the person is having stress, he will visit a psychiatrist or a psychologist. We do not see that in India. We see that people suffering from stress-related disorders do visit gastroenterologists, cardiologists. People may be having some kind of palpitation due to a stress, but he or she will feel that I'm having a heart problem, so he will go to a cardiologist. People will have stomach problems. Lot of referrals I get from Department of Gastroenterology, and that the person has come to me because he's having some gastrointestinal issues, but actually there's nothing on all the investigations. All the investigations are normal. So we know that this is due to stress. So Dr. Sumit, you take care. So lot of visits to the hospitals are not due to physical problems, but actually stress-related problems. But people don't prefer to visit to a psychiatrist or a psychologist due to stigma. So they visit other doctors because they don't take care of their stress, which lead to problems in stomach, problems in heart, problems in breathing. So they visit those doctors. They find them that it is nothing due to lungs, it is nothing due to heart, everything is fine. Everything is in your mind. So you need to visit a psychiatrist. So finally, we get the patients, and almost 10% of us do suffer from significant distress. And again, India is one of the countries. This is again one of the articles published recently. So India is at the peak of this epidemiology of mental health problems. So the next question, by now we have understood why this presentation is important and why we need to have a session on this. Now we need to understand from where the stress comes from. What are the things which causes the stress? It is absolutely clear that we all can have stress at some point of time, but sometimes we do not recognize what actually is causing stress. Why I'm not happy today? Why I'm a bit of jittery and bit of anxious today? Why my mood is not normal today? So if we understand the things which can cause stress, it will help us to better recognize them and better manage them. So what are the common things which can cause stress? Stress can come from inside, from our body image, that I'm not looking fine today. I'm not reacting the way I should be. I was not properly dressed today when I met her or him, or towards my teacher or towards my friends. So it also can come from self-esteem, not feeling good about oneself. It can come from conflicts from within, when we are not sure of ourselves, when we are not sure of what we are supposed to do in life, when we are not sure of what we are supposed to do in a day, when we are not sure when what we are supposed to do in an evening. So it can come from inside. Also, it can come again from outside. Environment can give us stress in a lot of ways. The situation around can give us stress. The political issues around can give us stress. The news can give us stress. The families can give us stress. So again, the family, of course, the family issues are one of the most common causes of stress. Something is not right in the family, maybe some financial issue, maybe some major health issue, maybe some conflict in between the family can give us stress. Then the workplace, of course, everyone knows this, workplace can give us various stress, the demands, the career demands, the demands from the management, the working hours, the difficult working hours. The interpersonal relationship at the workplace is also a major cause of stress. The next, friends, of course, can give stress. Sometimes affect is even a small issue in friendship can give us nightmares. Of course, society at large can be a part of stress. The society will keep on asking some demands from us, like do this, do that, we should be doing this, we should be doing that. That also can be part of stress. This was a question raised before the start of the session from one of the participants, probably Mr. Jitendra raised this question, and also Dr. Swati touched this also. Is stress good or bad for us? Yes, absolutely, no doubt, stress can be good for us. And that good stress is called eustress. Okay. So eustress is something which motivates us, which helps us to maintain our timelines, which helps us to maintain our targets, to achieve our career goals, to achieve our financial goals. But beyond a point, that stress can be a bad stress. And some ways can be used, some very simple techniques can be used to convert this bad stress into eustress. And stress management techniques help us in achieving this kind of goal. So I will request everyone here to type SMT in the chat box, which means stress management techniques, and we will move into them maybe today, maybe on next session. So please type SMT in the chat box. Now the next issues, by now we have recognized what are the causes of stress, and now we are moving into what is a stressor. Stressor is an environmental condition that places a physical or emotional demand on the person. So we now go to know from where a stressor can come from. It can come from family, it can come from our inside, it can come from workplace, but what actually are they? So there can be a physical stressor, which can be kind of these, like bad furniture. We always like our area to be neat and clean, to be well managed. But a poorly managed room or poorly managed office or poorly managed house can give us stress. It is not that we need to have very expensive furniture, but it has to be well managed, very clean. All of us know that if our space around us is pretty clean, well managed, the things are at their own places, we feel a little better about it. Poor ventilation can be a stressor. In closed places, people can have a lot of stress. Of course, overcrowding roads. We have seen in India now, every city has this problem of traffic. This overcrowding is also a stressor. Air and noise pollution is a stressor, is a physical stressor, and can give us kind of heaviness in our head. Then transportation is always difficult. Transportation in a crowded sources can also be stress. Overpacked rooms can also be stress, and of course prolonged working hours. So these are the common physical stressors which all of us can have. Then what are the psychological stressors? Of course, psychological stress can be relationship, a romantic relationship, a non-romantic relationship with parents, relationship with colleagues, relationship with the seniors, with juniors. Then again, conflict with the spouse or parents can cause stress. Secret life can cause stress. A lot of people are different to the people from how they actually are. So even having a secret life is not to cause some kind of stress. Then media, of course, is a stressor. We have been fed with news which are negative in one sense or the other. Always for their own gain, media will choose news which can cause stress to us, because then we will get attracted towards it. So again, media is a big stressor. Poor appraisal, of course, can be a stressor. Forced competitiveness. This is very significant. Forced competitiveness. Sometimes we develop this kind of jealousy with our colleagues, which is not needed and not warranted. Although we know that is not significant in our career. Some small things, like he or she who is actually our colleague doing little better than us, although in career we know that will not be significant. Even in schools we see this kind of thing. Forced competitiveness, bringing competitions where there is no need to bring it. So again, forced competitiveness with our colleagues is cause of stress. Why we need to worry about a small kind of competition when our careers are going to take very different paths maybe, and the final result, the final financial and career goals are going to be very different from what they are now. So sometimes we need to ignore this kind of competitiveness. Then again, conflicts with superiors, frequent changing of job, bullying, peer pressure is kind of psychological stress. So how do we do what we do when we face stress? Usually there are these three responses caused by our corticoadrenal system: fight, flight, and freeze. We may try to manage stress, but may react to stress very badly, or we may run away from the situation. We may be very evasive, or we may freeze in the situation and stop reacting. So usually these are the three kind of biological reactions from stress. But ultimately, how we react to a situation depends upon us. So we should stop blaming others sometimes. It is very often that when we are in a stressful situation, we start blaming our loved ones, we start blaming our teachers, our colleagues, our seniors. Sometimes it is not the case. Sometimes it is comes from inside. Sometimes a stressful situation depends upon our reaction rather than anything else. So sometimes we should take it lightly and stop blaming others and see how we have reacted to the situation. I will cover all these things, how to manage stress, in my later presentation. So this is what I meant. When we get stressed out, it depends mainly on us and not on others. So if we improve ourselves, if we develop some kind of coping skills to manage stress, we can handle them better, of course. Now, what are signs and symptoms of stress? What are the warning signs that I am in a stressful situation these days? How we recognize that I am also the one who is suffering from stress? We always say, "मेरे को तो कोई stress नहीं होता." No, I am not having any kind of stress. But sometimes we do suffer and we do not recognize it. So I will cover some physical signs and symptoms and cognitive signs and symptoms of stress. These are the physical signs and symptoms. Sleep disturbance is very common, very common. We will get difficulty in getting the sleep. We will have a difficulty in maintenance of sleep. नींद आ गई पर बीच में टूट गई. Dryness of mouth is one of the symptoms of stress. Poor appetite or even overeating can be stress. Feeling tired and fatigued when we do not feel like doing anything is a sign of stress. Headache, body ache, and muscle pain are other signs of stress. Then again, having a significant anxiety can cause increased heart rate called palpitation. They can cause constipation. We may feel sick. We may start having fever, cold, even diarrhea during stress. So sometimes a lot of fevers and a lot of physical problems are due to stress other than any viral infection, I'll say, because stress too causes lowering of immunity. Then what are the emotional signs and symptoms of stress? We may start interacting with others. We may stop picking up calls, stop reacting on social media, stop responding on social media. Then there will be lack of interest in previously pleasurable activities. That means the things we used to enjoy, we will stop doing them. We will stop enjoying them any longer. Again, stress can cause nightmares. It can cause impatience, a jitteriness kind of feeling, and it will result in reduced self-esteem. And sometimes we have this obsessive rumination, thinking upon the same topic again and again. This is called obsessive rumination, which is a common emotional sign of stress. Then we can have irritability, anger outburst, depression. We may feel morbid jealousy kind of things, restlessness, and decreased perception of positivity. We may not feel positive at all. There are some cognitive signs of stress. Forgetfulness is pretty common in a stressful situation. Blocking. The thought we had has completely disappeared. We do not know what I was thinking about. This is again common cognitive signs of stress, and lack of concentration, lack of attention again. And there are some behavioral signs of stress. Again, overeating, I've already mentioned. Nervous laughter, laughing in a very nervous situation. When we have nothing to answer, then we will create this kind of grin on our face when we are nervous. And again, impatience, withdrawal from the situation, hostility towards someone, and anger towards someone. And proneness to accident, we may go into some kind of addiction, which is very dangerous. Increased smoking, aggressive behavior, road rage, again drug abuse, carelessness. So these were the signs of stress. What will be the indications of stress when we are in a stressful situation, how the body will react to the stress. So these were the indications of stress. And this is one of the theories pretty much in use.
Dr. Sumit,
Yeah.
A lot of participants are getting stressed on getting to benefits directly. That how to get the stress relieving thing. So
well, Dr. Swathi, that is the part of my second presentation. I will finish this presentation soon, and I will take questions in this session. But how to manage all these stresses will probably be covered in the next session, because again, if you do not understand the stress, it is difficult to manage them. So that's why this session was very important. How to understand what are the signs of stress, how to manage it. I hope this is presentation is not giving a lot of stress to the participants. But again, I will complete this small theory, which is pretty important, and then I will take the questions.
Yes, Dr. Sumit. So, dear participants, please have patience, and let's recognize the symptoms of stress. So, regularly messaging that it is we want the benefits directly is again a stressful situation for you and us. So don't create that situation.
Don't worry. Yeah, we'll come to that. Definitely, that is the most important part, but probably it will not be covered today. Yeah, thinking and stress story. See, why I mentioned all the cognitive symptoms, emotional symptoms, behavioral symptoms. So how our body reacts to all these things together, how a stress can affect the whole body. Because there's a theory given for it. When we'll have some thought and images of a stressful situation, we will start feeling bad about it. And then we'll react in a way which is not expected from us. And then it will lead to physical symptoms. So this is how a single stress can affect our whole body in terms of emotions, in terms of reactions, in terms of physical symptoms. This is an example. Say we are in a situation that we cannot face, we are feeling that we cannot face this problem, it will lead to low mood, and then we will, due to low mood, we'll stop meeting people, we'll stop interacting with people, and again it will give us kind of physical symptoms. So this is how a single stress can affect the whole body in terms of emotions, in terms of physical symptoms. So the bottom line is, it is not necessarily that how people feel at stress, but it is how quickly we recover from them to prevent its worse effects on our health and well-being. This session will be completed today because there's a next very important session where I'll be giving you tips to manage all this stress. I'm assuring you that tips will be very simple and very basic. We all know those tips, but we fail to use them when required. But again, it is very difficult to cover everything in this single session. I will end this session saying that you cannot stop the waves, but we can learn to surf. तैरना तो नहीं सीख सकते, लहरों को तो नहीं रोक सकते, but तैरना जरूर सीख सकते हैं. Yeah, thank you. I hope the situation did not give you a lot of stress. I have this mail ID over there, but I will coming a lot of your questions in the next session also. But I will be happy to take few questions today also.
Yes. So, Dr. Sumit, few tips, if you can just share with us verbally, because most of the questions are regarding how to handle stress from boss, how to, what kind of red warning flag. Okay, this question I'll take from Harshit. How we know kind of red warning flag that indicates too much stress? What is that red warning?
I was again going to cover this in next session, but anyway, I will brief it. See, there are some symptoms which suggest a development of mental health disorder. Okay, usually a stressful situation lasts for few hours to 1 or 2 days. Okay, then there's a human brain resilience. I can I speak in Hindi, or even, because a lot of people, anyway, I'll go on because some people may not be comfortable in English itself. See, there's a human brain resilience concept, which is we have seen that a lot of people might have faced a very, very big stress, kind of lost of a lot of loved ones in a single incident, maybe a war-like situation, maybe when their houses are gone, maybe when the loved ones are injured or gone. So, but over the years, they do recover and they do get involved in their activities. Like again earning money, again doing a job, again developing relationships because of human brain resilience. And talking about day in day out stress, usually it takes few hours to few days. But if some particular issue is lasting for a longer period, like for 2 weeks, like if we are feeling if we are feeling sad for more than 2 weeks, if we are feeling loss of interest in previously pleasurable activities for longer than 2 weeks, if we are having a kind of fatigue for longer than 2 weeks, then it may suggest taking a professional help. So the point is, usually we do recover from stress from our brain resilient and using some basic coping skills. But if it lasts longer, it may suggest a mental health issue from where we should take the help of a mental health professional.
Okay. So basically, it's a time which gives you that warning that if you're recovering, between some few hours or days, it's okay. But if you are still stressed after 10 days or more, I think that will require help from a professional. How can we remove stress from office life? Okay, again, techniques.
Yeah, we will be discussing them. I assure you, I'll be giving very, very simple techniques to everyone, very basic techniques, which you all know. But I will be probably covering them in detail in next session. But it is actually important to understand what gives us stress before moving on to how to manage it. So it is again always easier said than done. I understand that there will be issues in office, as I mentioned, there will be issues in family. Everyone, each one of us will face stress in one or the other way. Someone will face financial stress, someone will face a health problem, someone will face interpersonal problem, relationship problem with seniors, at job, at home. And there are no magic skill also. When we use our basics, our basic coping skill, that is where it helps the most. I assure you, I'll be telling at least 10 to 20 tips in my next session, and they will be very basic, which we all can use in day out. If we even choose 2 or 4 of them, then we will be able to better cope up with the situation.
Okay. As a one question has come, as a team leader, how can we understand that any of our team member is actually facing excessive stress? That's a good question.
Yes,
Absolutely. They have to manage a team. So what are...
Yes. See, the best way to understand not only the stressful situation in one of our colleagues or even our juniors or seniors is to develop a healthy communication. When we communicate with, say, our team, we sometimes should assure that it is not always about the particular job where we all are working for. Sometimes we should go into discussion beyond that and develop a healthy relationship. Maybe develop a group outings, maybe sometimes have a meal together at the office or outside the office. So then only we will get some signs that yes, this person is disturbed from that particular situation. And then we have to be a patient listener. Developing a skill of patient listening is also pretty difficult. कभी कोई अपने स्ट्रेस के बारे में बता रहा होता है तो हमें लगता है कि मैं फटाफट अपनी प्रॉब्लम के बारे में बताऊं, ठीक है. So sometimes we need to keep others speaking, let others talk, let's see what he or she comes out with, let other ventilate on neutral issues, on the issues which are not related to work at that particular time. So then only we will give some signs that the person is in some kind of stress, and let him or her talk, let him or her complete before interrupting or giving him or her answers or giving him or her ways out. So the best way is communication and effective communication.
Thank you. So effective communication. Okay, that is another workshop that we have to focus on every time. Okay, all rest questions are about boss and stress management techniques. Would you like to share something, Dr. Sumit, with us? Any case where, since this session is more focused for pharma professionals, you do see a lot of pharma professionals, in your chamber, or briefing you about their products and all. Do you recall any incidents where you saw stress and you had a talk with them or something like that?
Well, we do see, it is difficult to recall any particular case as far as field of pharma is concerned, but we do get a lot of patients from even people related to pharma who visit us for their own problems, and again students, again housewives, again professionals from various fields. It is my job to first of all understand how significant is the problem, and whether he or she is suffering from some under kind of mental health condition. But many times not. Many times it is not that there's a diagnosis of depression or anxiety. Many times it's just a brief stressor going on in their lives, which they are managing in a bad way. So usually it is important to guide them again how to handle such a situation, how to handle the relationship, or how to handle their situation with seniors. I often give them one concept, especially to the professionals. This is also applicable to all of you guys. Probably a lot of them are asking how to manage the relationship with boss. Sometimes we cannot manage the boss. Okay, he's a different person and he has different demands from his own seniors, his own administration, his own management. So sometimes we cannot manage the situation outside us, but we can manage ourselves. I give them a concept of comparative stressors. Always when we compare our stress, it will be lesser than somebody else's stress. Okay, I understand that my boss is too demanding from me in terms of time, in terms of kind of targets they want us to achieve, in terms of kind of relationship they want us to develop. But there are persons who are in a worse situation from us. There are persons who don't have a job. There are people who don't have enough sources to manage their families. At least we have a good personality, we have a good job, we have a good working condition, and we are being able to manage, and we do have a chance to grow. So sometimes just thinking that this law of comparative stress, that my stress may be lesser than somebody else's, it gives us a kind of calmness. So sometimes we have to accept the situation the way it is, and keep on moving, keep on doing whatever we can do in a situation, and without thinking upon it for a long time.
Okay, so you are stressing the point that don't stress over a single point. So yeah,
it is easier said than. I understand that when there is a stressor, it is easy to take that out of mind. But sometimes we can give us a feeling of calmness by thinking that other people may be more stressed than us. Some people may even who are as educated or even more educated than us, or even may not have a job at this point of time. So sometimes it also gives us a feeling of calmness. They're all small skills which help us, but sometimes we need to use multiple skills. Not sometimes single skill doesn't help us. So we have to have 10-15 tools with us at a single time to manage a stressful situation, and even 2 may be effective, 3 may be effective.
wonderful. Thank you, Dr. Sumit. One question is coming from the perspective of micromanagement. Like some bosses are very keen on micromanaging. My boss during fieldwork irritates me. Question reads, I will read out the question. My boss during fieldwork irritates me of asking any question. And if I do alone working, then he call me every 5 or 10 minutes, taking feedback of every doc. Means a typical pharma medical rep situation is happening. What should I do of this kind of people? Means he, again, I think the question is same, how to manage your boss, and the answer is already there. But do you have any perspective on micromanagement? Why should we avoid it, or when we recognize that we have started micromanaging?
Managing stress is a practice. It will come with time if we start doing them. I again give one technique to my patients, even to my students, that start managing stress from when it is on lower side. Okay, see, when we are going in a traffic, we are feeling stress because people around us are not driving properly, and it is giving us kind of stress. So we should start ignoring them. Okay, rather than again curbing on that, again thinking on that, why he's driving that like that, why he's speaking like that. Sometimes in some situation we cannot help. So ignorance is a bliss. So just try to take the traffic around you out of the picture. Just practice it there. And then when the difficult situation will arise, for example, as you mentioned with your boss, somebody else's boss, that he may calling the person again and again, asking for feedback, disturbing. So sometimes yes, we can answer, and sometimes we have to ignore whatever he or she is saying. Okay, it is not that we need to keep everything in mind, whatever he says. Yes, he has asked a question, we have answered to best of our abilities. That's it. Let the thing go. But this skill will come slowly when we will start practicing it in a little lower situation. For example, a news is coming on the TV, which is stressful news regarding religion, regarding politics or something, and it is again giving pressure on our mind. But we must start ignoring it. अरे कर रहे हैं तो कर रहे हैं, हम क्या करें, अब हम कुछ नहीं कर सकते, ठीक है. We must develop a skill to ignoring some of the stressors. Again, I'm mentioning there is no magic thing about it. Okay, I cannot change your environment, but I can help bringing a change in you. You have to practice this, is bringing a change in yourself. Your boss, I cannot change him. Your boss nature, I cannot change him. Your job situation, I cannot change that, but I can give you some basic skills which will help you in managing. So boss will not change. You have to develop skill in yourself to ignore sometimes whatever he says. Answer him whatever you can with a smile, but don't keep your boss's talk in your mind. So, and this will come with practice.
Sure. One important question is, you talked about eustress. How stress can be beneficial? Can you elaborate on this?
Yeah, we all know that. That's a of course self-explanatory answer. Stress helps us in meeting our targets. See, we will not reach office on time if we are not asked to do so. Okay, some stress important to achieve our career goals, to achieve our financial goals. We have a kind of stress to create finances for my future goals, for my family, for my career, for my marriage, for my education, for my children's education. So they are kind of stresses, but that help us to achieve our targets in by working in a healthy way, by taking them in a healthy way and managing them.
Yeah, and yes, again, if there is any question regarding recognition of stress and what is stress, please put that in the chat box. Stress management techniques, as Dr. Sumit already mentioned twice or thrice, that we will be taking up in the next session, hoping that is not causing any stress on you. We will host this session next Sunday. Yeah, okay. Dr. Saurabh has raised hand. Would you like to interact?
Just a sec.
Yes.
Yeah, Dr. Saurabh Kataria, you can ask any question.
Hello.
Yeah, Dr. Saurabh.
Yes.
So
Okay, so let
I
us,
can-
okay, my boss, again, same questions. So I think that next session would be the more important session for recognizing or getting the tips from Dr. Sumit on managing day-to-day stress. And we will open the forum now for one-to-one interaction, but please do not ask again the same question, that please give us those stress management tips and techniques. We will do that. And that's a promise, and we will keep that.
So we should allow the, there is some hands raised. So Mr. Aditya Trivedi, you raised the hand quite early. So if you want to ask any question, you can ask to Dr. Sumit. Do you have any question to ask? If anyone is having any question, you want to interact right now, you can raise your hand. We'll unmute you and you can interact. Okay, so Mr. Aditya, okay. So I think he's not. So Shivam Mawasti, any questions you have? Do you have any question?
Please unmute if you have any question, and you can directly interact with Dr. Sumit.
Okay, let's move to the next. Dr. Ami.
Hello.
Yeah.
Hello.
Hi,
Yes.
Dr. Mehta. First of all, thank you so much for your insights. They were really invaluable, and we will work on them. Dr. Swati, thank you for arranging this. I just wanted to add a little bit based on my own experience. See, 2 or 3 times you mentioned that stress can be positive also. And that helps us in accomplishing targets, etc., reaching office in time, and so on and so forth. But, I would still like to, would not really advocate this, because people will start using this as a reason to force their subordinates and colleagues to put up with pressure. नहीं pressure अच्छा है, आप चलते रहो. What the examples that came about achieving targets and accomplishing success and all that, those are barely following rules. If there is a time in office, you have to reach there. That's not a cause for stress. You can't call that stress. If somebody is taking stress for following a simple rule, then he or she seriously needs psychiatric evaluation. Okay, so that's a different issue. Stress, by and large, what we are referring to today is an adverse entity which will not go away. As you rightly said, the waves are there. We have to learn to swim and tide them over. So how best to do that is what we will talk in the next session. But to all the people listening, my humble request is, stress is not a good thing. And don't use it as an excuse to tell your colleagues and subordinates, "Hey, chalta hai, to hota hi rehta hai." Okay, ye hota rehta hai is correct, but you have to learn to deal with it. So that was one part that I just wanted to highlight, and quickly, without taking too much time. One thing that I have 30 years in pharma and I'm 60 plus, there is a lot that I've seen, and I'm still under stress. Okay, but one thing that really helps is, don't worry about that one little project in your hand at this moment of time. In the long run, what people remember is not your one project success or failure, but how you were as a person, as a human being, as a professional. So always keep that in mind. Be nice to people. Be nice to your boss. Be nice to your colleagues. Be nice to your subordinates. Be nice to the housekeeping staff and everybody else. They will remember you for that. And if you are nice, they will be nice, and that takes away a lot of your stress. So besides whatever Dr. Mehta is going to tell us in the next session, this is just my little submission. Be nice. Learn to be nice no matter what. And people will love you for it. They will remember you well for it. And, that takes away a lot of your stress and makes you feel happy. Okay, thank you. Sorry for taking up too much time.
Thank you. Thank you, Mr. Amit. Dr. Amit, and, sharing your perspective on this topic also. It helps all of us here. And please ask the question top. Okay, there are issues, very minute issues being asked. There are top bosses thinking that shouting on junior works. Shouting is a behavior, Dr. Sumit, which we come across during work or even in personal lives also. Why this is happening more and more, and even if they are wrong, how to understand them and correct the things when someone is shouting, how to handle a situation like that?
See, sometimes again we have to understand the person's situation also. Obviously, if he's shouting, probably he's also in some kind of stress. That's why he's doing this. So it comes from top, and it is prevalent everywhere. That is the issue. Probably the boss himself is not recognizing that he might have been suffering from some kind of stress and might have been responding in a way which we should not, leading to a counterproductive cycle. He will give stress to his junior by shouting on him. Then the performance of the junior will deteriorate rather than improving, and it will again give more stress to the senior also. So there's a vicious cycle which goes. Sometimes we react because we are suffering from something, then but the person opposite to us may not understand that we are suffering, that's why we are reacting, and it may lead to poor response from opposite person. Then again it will come back to us. So of course these kind of things are not good. It is important to manage stress at every level, but if your boss is shouting, we must understand that he must also be suffering from something, and we must be able to, again, as the person said, absolutely right, we must behave properly. We must develop a skill to be calm always, but that is easier said than done. Again, we must be good with everyone, so that the person will also realize that this person is good. In day-to-day situation, that becomes difficult when the person is putting pressure on us all the time. Then it is difficult to be good with them, but that is our job. We have to use, again, multiple skills. We must develop skill of humor, we must develop skill of eating good, we must develop skill of good sleep. So all these things will help us in managing. But again, ignoring something, we must develop skill key. the stress will not go out of our environment. The things will not go out of environment. Again, I cannot change your boss. You will not be able to change your boss. Okay. You will not be able to change his behavior, nor will I. Currently, my clientage is you. It is whatever change I will ask them to be made in you. Okay. I cannot change your boss. You must develop some skills to ignore his behavior, and you must develop a skill to stay calm from inside.
Thank you. And one more question I'll take, and then we can close the session for today. But tips are most awaited from you. How to stop overthinking? How to
Yes.
recognize that I am
Yes.
overthinking and then stop it?
Yes. Okay, I will mention it. Again, that was a part of my next session. Again, I mentioned it. This is called obsessive rumination. When we are thinking about the same thing again and again because of some issue in the day or maybe 2 days back, there are many techniques. First is called thought blocking. What you need to do in thought blocking is you need to develop a new thought which gives you interest, which really gives you interest. For example, a good travel, a good movie, a cricket scene, a football scene which you like, which is your hobby, which you really like. For example, somebody likes traveling in a beach like situation, so develop a scene in your mind when you are in that situation. Then you bring that in your mind and start thinking about them. But I tell you that thinking of good scene will last for just 30 to 50 seconds. Again, the bad thing will come, the worst thing, the thought will come in your mind, which is affecting you. Then again, you have to stop. No, I need not to think on this. I need to think a good scene, which you really like. Then again, bring it in you. After 2-3 efforts, the good thought will persist and the bad thought will go away. So make a new scene. This technique is called thought blocking. Make a new scene which you like. Start thinking about that. Then again, the bad thing will come. Then again, bring the new scene and thinking about that. Finally, the good scene will stay and the bad thing will go away. Second technique is called container technique, which I will discuss in next session.
Wonderful. So
This is called
one
thought blocking. Second technique is container technique.
Okay, so one technique we all can practice till the next session. One tip has been given: just block the overthinking thought that is in your mind. Try to imagine something which you like and get into that zone. Even if
Bring
again,
fantasize a new scene which you really like. You can think, you can develop a scene, you can develop a scene being with someone you really like, being with an actor, being with an actress, and develop that scene, and then you may stop thinking about that bad thing. So it will be innovative while doing this. That thing must really interest you, and again, in only after 2, 3, 4 attempts, the good scene will persist. Otherwise, if you're very worried, then again the worrisome thought will come again.
Dr. Sumit, there was one question which I liked. It was saying, is there any research where there is a correlation between the blood group type and stress? Is it something?
No, absolutely
no?
not. Absolutely
No?
not.
Okay.
No evidence as yet relating blood group with stress.
Okay, because there are many times these type of myths are there. So that's why I thought
absolutely,
I
it's
should
a myth.
clarify this. Yeah.
No relation with blood group. It is related to deep genetics with some dopamine receptors in brain, and so not related to blood group. It's not that simple.
thank you for clarifying this. It is coming from an expert, so you can take the word of the doctor and drop that thought that it is related to any blood group. So yes, practice this one tip or technique. If you are overthinking, don't overthink about the session also. It will come your way on next Sunday. Aditya, you have again raised hand. Can you unmute and ask?
Yeah, Mr. Aditya, you can unmute yourself. Yes. Oh, he again. Yeah. Okay.
I think he's facing
Maybe there's some technical issue. Yes.
Yeah. So we will bring the next session with more tips. One tip is brilliant tip, I would say. If we all start practicing, we may get relieved of situations where we are into overthinking about something. Is overthinking related to OCD sort of thing, Dr. Sumit?
OCD is a disorder. OCD is a disorder. See, overthinking day in day out stress is not overthinking about day in day out stress is not OCD. OCD is a specific disorder where some specific thoughts come which stays for longer, but they are not related to stress. Okay, For example, the thought of cleanliness, कि मेरे हाथ साफ नहीं है, my hands are dirty. This is not related to stress, but this is a thought which gets stuck in people's mind and keep on coming again. So they keep on washing hands again and again. Then again, the thought will come that the hands are not clean. Then again, they will go and wash. So it is not related to stress. Just overthinking is not OCD. Be sure whatever I am talking about is not related to mental health disorders. Stress is prevalent in everyone, but not mental health disorders. Please, not everyone says having any kind of stress is having a mental health disorder. We are talking about day in, day out stress, ways to prevent mental health disorders. All these are not mental health disorders.
Thank you. Thank you for clarifying also that, Dr. Sumit. Around this time when we all are, Googling symptoms, Googling techniques, we are simply going on Google and writing and typing and getting answers from AI, maybe from Google itself. There's a lot of misinformation that has gone into people's heads, thoughts also. So that is why coming from an expert, these pointers are more important for us to understand. We all have that scientific query inside us, scientific curiosity inside us. Let's be curious about science and get our answers from experts. And Dr. Google is always there, but please do not, rely on Dr. Google for any and everything that we are talking about, your diseases, your thoughts are all.
Dr. Sumit, there is one question from Mr. Alpesh, interesting one. Does stress affect immunity?
Yes, it do. I mentioned this in my presentation. It do affect those who are in more stress are more liable to get infections, more liable to get fevers, more liable to get diarrhea. Yes, absolutely. A persistent stress, not a single stress, but persistent stress do affect our immunity.
Okay. So yes, stress is going to affect the immunity in case you are persistently facing this sort of situation. So I think we can now end the session for today, and don't take stress of the next session. Again and again, I'm telling, we will bring that session. It's a promise to you in next Sunday with all the tips to manage stress.
And just for the audience, that this StressBuster program is actually not a single or two session program. It is a continuous program that we are bringing, where you will have yoga sessions and all these sessions. We'll be using online mode only to reach to more and more people, so that more and more people are benefited. So it will be there, and very interesting sessions we have planned. So be there in the group, be connect with us, and do keep on sharing your feedback through the feedback form. What do you require from us? If you are thinking to manage stress, we'll try to bring that for you.
Yeah, thank you, Dr. Satish. Thank you, Dr. Sumit, for sharing your thoughts on stress and next session, stress management. Happy to host you today, and a continuation will be there on the next Sunday regarding the stress management techniques. Thank you for giving us your time and joining us today.
Thank you for having me.
Yes, we will be there next Sunday also.
Sure. Thank you.
So have a wonderful Sunday ahead.
You all too.
Yes.
Thank you.
Thank you so much, Dr. Sumit. Thank you, sir. And thank you, Dr. Amit. Thank you all for joining in.
Thank you, everyone. I'm just posting a link to the feedback form to let us know your thoughts about this session. How was our performance? And we will try to improve and make it better. Thank you, everyone. Have a lovely Sunday. We are ending the session now.